are some similarities, but there's many differences. Chemotherapy now is kind of it's growing into a larger discussion of the older type of chemos, the more cytotoxic chemos that affect all your cells. There's 5 types of basic types of chemotherapies. Radiation is X-rays or radiation that destroy or shrink tumors. Oftentimes they're given before surgery. Many times they're given after surgery. Sometimes they're just used alone, standing alone. So there's internal radiation, there's external radiation, there's targeted radiation. So I would say the major differences is typically, as far as maybe 10 or 20 years ago, most chemos were an IV that you would give into a patient, and they were cytotoxic. They would affect all the cells instead of just the cancer cells. Typically, the older chemotherapies are given for a number of different malignancies, and they target a cell cycle. There's different cell cycles for normal cells and cancer cells. So typically the older chemotherapies would target the cell that is trying to divide and stop that division. But also older chemotherapies can harm the normal cells. The newer targeted cells based upon genetic profiles are geared more to go after the cancer cells and the tumor cells versus the normal cells. I myself, on targeted therapies, it has some side effects, such as bleeding, such as ulcers, such as some cartilage problems in my nose. But sometimes with the newer therapies, the side effects are more minimal than the older chemotherapies. Dr. Keith Block, who is the one of the founders and one of the leaders in integrative oncology, who's out of Chicago, he's got a number of, I think he has a number of books out. He's got a wonderful book that came out before my book. And he suggests that many people, cancer patients and survivors, die from the side effects of radiation and chemo versus the people that just die of cancer. He's made that statement a number of times. It's in his book. And again, that's why I try to caution people before they go forward with their treatment. I've had many people come into my office every year from different states, and they're getting a suggestion off the bat of major surgery and a more toxic chemotherapy. I'll refer those patients out to my oncologists that I trust here in the Midwest, who are more eclectic, more open-minded. And then they'll refer the patient, say, to a surgeon who does a more minimally invasive surgery and might put the patient on a less toxic radiation and chemotherapy regimen than they were first suggested. So again, doing your homework is critical if you want less side effects and a longer survival time.